Good evening, everybody. This is Cecile, lead parent educator at Malak Mum and Baby Care. And we are live tonight talking to you all about being pregnant, having babies, just answering your questions, giving you some hopefully amazing tips and helping you get as much advice as possible. So we're just waiting, letting people come on. I'm going to give them 2 or 3 minutes and then we will start talking about basically, so you are pregnant and your baby is coming home. So good evening. Seeing some amazing mamas coming on, joining us this evening. So hoping to give you some really good tips on all the list of advice that I've actually got here that I want to talk about tonight. So looking forward to talking to you. Please post your questions. The best way to help me help you is post your name, your baby's age, please, along with your question. This way I'm able to give you the right advice appropriately. So please post those questions. I am watching for them and I will be trying to answer everything that happens tonight. So like I said, I'm just giving people 2 or 3 minutes to join us. I'm seeing some of our regular mamas here and it's so lovely to be online talking to you again. So giving you a few minutes. And of course we've seen our amazing QV baby join us as well, as in the amazing brand and product from Australia that we just love. And we have Sephora from Azerbaijan. Welcome. That is amazing. So good to have everyone joining us. And I know it's not always the most convenient time. In fact, in the Middle East, it's basically bedtime now. So if you're not able to join us, this will be posted live on Instagram. And it will be on QV's website, QV's Instagram page as well, for those of you who follow them. So giving them 1 more minute and then I'm getting started because I've got a lot of subjects to cover tonight. And I'm really looking forward to it. It's one of my favorite things is to talk to mamas all about their babies. So getting lots of lovely mamas that I'm seeing here joining us that I know really well. And I'm just waving hi to all of you. Okay, so let's get started. So you're pregnant and you're bringing your baby home. First of all, what I want to, and I know a lot of you do have babies there already, but do you remember what they looked like at birth? And that's what I want to talk about. You know, when your baby is born, their skin is so beautiful. It's clean, clear, and their heads are a little bit misshapen. And they look at you with big eyes because for the first time, they're actually exposed to things like bright lights like we have here tonight. And cold, loud sounds. They experiencing touch. Even although touch is a sense that's actually developed in utero, they're experiencing it for the first time. They're experiencing gravity for the first time, where basically they suddenly can't lift their arms up any longer without making an effort. So they're undergoing a lot of changes at birth. So initially, when a baby is born, we expect, because we see this on the movies, that babies cry. And actually, babies are born quite quiet. They're placed on your chest, we dry them, we warm them up, and then they start to react. They start to actually talk back to us. And I love it when a baby talks back to us. Every midwife in the world, every obstetrician in the world, I think, feels the same. When that baby is nice and cheeky and active, we are so happy. And then looking after their skin in the hospital is going to be where I'm going to suggest you don't bath them for first 24 hours because that skin is undergoing so many different changes. People touching them, basically their clothing, the mattresses, the bed sheets, everything. So I suggest don't bath them at all for the first 24 hours. Put them on your chest, let them stay here, let them stay in a familiar environment, and keep them skin to skin as much as possible. Skin to skin is not only beneficial for your baby because it triggers about 20 different primitive reflexes, but it's actually beneficial for bonding. It's great for feeding. And when we talk about feeding your baby, yes, we are going to focus a little bit on breastfeeding, but we're not saying to the mothers who've chosen to bottle feed that you're wrong. Every mother has the right to make that choice, and we will always respect it. But breastfeeding is such a difficult thing in those first few days because there's a few things going on. You don't know how to do it. You don't trust that you can do it because it's become a bit of a science. But I want you to truly believe in yourself, to truly believe that you, as a mama, know exactly what to do, that your baby knows exactly what to do. And putting them skin to skin, letting them crawl up, letting them attach on the breast, and making them kind of feel safe and secure on your abdomen, they will follow what I always term the 8 steps. And that is baby to mommy. Mommy should get ready. She should be in a comfortable position. Then chin first to the breast and nipple to the nose. And I do recommend that you roll your nipple to let it stand up a little bit. And then your baby won't need you to do the next step, which is guide the nipple into their mouth. They will guide the nipple in themselves if they are on your chest. If not, and you're holding them, then you do need to actually guide the nipple into their mouth. Then you need to watch this like swallow sequence. And that is watching that from their lips to their ears is a nice round chipmunk cheek kind of looking face. And that you're seeing their ear moving a little bit. That you're seeing their jaw dropping down. Because there's a lot of things you can't see. And the most important thing is it's comfortable. There may be a little sensation, but there shouldn't be discomfort. And if there's discomfort, take your baby off. Take a clean finger, go in and scoop the nipple out their mouth and start again. And when you take the nipple out the baby's mouth, look at the shape of the nipple. Is it nice and round, just pink and moist? And feeding will take you about the first 3-4 days to get used to. It'll take you a good 2 weeks to establish almost a good attachment. And please don't wait to call for help when you need it. Call early, that we make sure you don't get any pain, any cracks, etc. And then it takes about 6 to 8 weeks for your milk supply to come in. And once it's established, 6 to 8 weeks later, it becomes so much easier. So let's talk a little bit about the cord. So when your baby is born, it's attached to the placenta through the cord. And we want you to practice, if possible, optimal cord clamping after birth. And we say if possible because this depends on what is happening with baby at the moment of birth, and only your doctor can know that. So we ask your doctor, please, if possible, at least 60 to 90 seconds of keeping the cord attached to your baby. In fact, even in a baby that's a little bit compromised, this is beneficial for them. Giving your baby a little bit of additional blood is truly beneficial long-term in protecting, not stopping it happening, but protecting against childhood anemia. There are other ways to protect against childhood anemia, like a good diet, and that's what we would use if we couldn't do optimal cord clamping. But once the cord is clamped and cut, your baby's circulation turns around to become adult circulation. And this is why babies are born with blue hands and feet, because they are protecting their vital organs in their abdomen. And by protecting their vital organs, we're not saying the hands and feet aren't important, but they don't worry too much about the hands and feet. You can encourage circulation to that area by putting, my favorite thing, a pair of socks on their hands to encourage warmth, to make sure that your baby actually then does have nice pink hands and feet. And in about a week, you won't even notice the difference. They will be all settled, the circulation will have changed, and actually their hands will be nice and pink. However, it is a bit of a shock sometimes for daddies if they see that the hands and feet are a little bit blue at birth. So we do want the dads to understand about this as well. Then, cleaning the cord. I will encourage you to clean with plain cotton wool and water. And my rule of thumb is wash your hands, clean the cord, change the diaper, which means you are going to be paying attention to that cord roughly about 10 to 12 plus times a day. The cord will start to separate. There's a natural bacteria that eats through and seals the base. That means there's a little smell, there's a little discharge. It's not bad. If it's not a good smell, if there's active discharge, please, you should see your doctor immediately. However, most babies' cords fall off within about 3 to 7 days and no complications whatsoever. If they fall off early and there's a little bit of an opening, keep cleaning with cotton wool and water, wash your hands, clean the cord, change the diaper. And if it doesn't disappear in about 48 hours, then we would suggest talking to your pediatrician about maybe using a silver nitrate stick to cauterize the area. Keeping your baby's cord nice and clean is very, very easy. And sometimes babies develop a little umbilical hernia in that area. Please make sure that what you then do is just reduce it down, put a nice firm diaper around it, and watch it. If it doesn't resolve after about a year, then we would refer you to a pediatric surgeon. And then let's talk about diaper changing. Most of us will be using disposable diapers, and there's nothing wrong with that. If you are a mom who wants to pay more attention to maybe cost, maybe preserving landfills, etc., then you would look at reusable. But most of us, at least for the first month, are going to use disposable. There's no right or wrong diaper to buy. In fact, I don't encourage you to buy a big bag. Buy a small bag, see how your baby likes those diapers. Unfortunately, every baby is going to react differently. But when you go to do a diaper change, make sure you have everything ready. Make sure that you have your clean diaper opened up already, that you've got whatever you clean the baby's bum with, cotton wool and water, wipes, ready there as well. And if it's wipes, I take a few out. And have a barrier cream ready to put on the baby's bum. Now, we want you to use a barrier cream that is as clean as possible. And this is why I recommend QV, because the barrier cream is exactly what it says, but it's not going to do any more damage. It's going to keep that bum sealed and anything in the diaper off of that skin, protecting the skin appropriately. And once you've opened your baby's diaper, if it's a boy, remember, put something on top because they point and shoot. If it's a girl, they are very cheeky and trickle. So you place your clean diaper underneath your dirty diaper. Clean your baby, remove the dirty diaper, and then you can put your clean diaper on nicely. And if there is a bit of a trickle or if there's a bit of a spray, you're probably not going to have to clean everything. When you're undressing your baby, make sure the clothes are high enough up and away from that area. And when you put a diaper on, you use a finger to go inside the diaper to check that it's not too tight. You make sure you go around the legs to pull out the elastics to keep everything in the diaper when they've used it. Let's also talk about bathing your baby. And I absolutely love bathing babies. I really miss the times when I could go to parents' homes and do these amazing times with them. At the moment, we're still staying safe. We're only doing essential visits. And of course, it's all behind a mask. And it's not a very pleasant thing. So that is why we're not offering things like doing a baby bath for you right now. But if you're going to bath your baby, and you are going to on your own, make sure you get everything again set up. Get the tub nice and full. And the water, you start with cold first and warm it up to, I say, skin temperature. As in, making sure if you put your wrist in the water, it's tepid, not hot or cold. And If you haven't got baby ready to bath already, then you might make it a little bit warmer and check it before you put baby in. When you put your baby in, make sure you've got your baby held securely. I don't, for newborns, support using any baby seats or anything like that. I like you to hold them in the bath and let them float, let them kick around, let them kind of, just stretch out. And start by no product in the bath, cleaning their face first. Cotton wool swab for one eye, throw it away. Cotton wool swab for the other eye, throw it away. We never cross over because we can get sticky eyes, and sticky eyes can be an infection, and if one is infected, we don't want to transfer it to the other. Then clean behind the ears, clean in their neck folds, please. Clean their face as well. And for this, you could use one swab, you could use a cloth, etc. And then you'd add some product to your baby's bath. In this, you can add the QV wash for their hair as well as their body, and you don't have to rinse it off. It's a very, very pure product, and it's what they call, and I love this word because it's so difficult to say, non-comedogenic. But guess what that means? Simply, it doesn't block the baby's pores. Remember, our skin is a living, breathing organ, in fact, and it really does breathe. So we want to keep it as clean and as clear as possible. We don't want to put anything on it that could cause it any damage. So we want to make sure the product we're choosing for our baby doesn't have things in it that are harmful, like formaldehydes, like parabens. So this is also soap-free product. So it doesn't actually take any of the natural oils out of your baby's skin either. And you can use it from newborn all the way through to your toddler. So you don't have to choose a new product. It'll keep your baby's skin nice and clean. So we've washed the baby's hair, we've washed their body, now we're going to dry them. Please make sure you're putting them in a towel and you're patting all over, especially in all the little nooks and crannies, to make sure that your baby is now dry. You don't want them to have little bits of moistness under their arms or between their legs or anything that could cause, again, a little infection to happen in that area. No questions coming through, mamas. Remember, please ask me as many questions as you like. And I'm seeing some amazing ladies that have just got on. So please join me and ask me questions. We're talking all about you and your newborn. We're talking A to Z, basically, of everything about your baby. And I've got a list of stuff, but I'm always open to asking, to answering questions. Thank you for your kind words, Sephora. I am loving being here again tonight. This is my passion, talking to mamas and their babies. And I do talk to your babies, by the way, and I think they do talk back. So let's talk a little bit about dressing your baby. Just a few tips. Every one of us is going to dress in different layers because every baby is going to have a different requirement. But what am I talking about? And this is something that I had a problem with my son. When you're trying to get something over a baby's head, oh my gosh, it's not easy. So making sure you're using your hands to widen it so that you don't pull it over their nose and their chin. Babies hate that. And when you're trying to get their fingers through, I suggest putting your hand in and grabbing their hand to pull it through. Why? Because a finger always gets stuck and we're very scared of injuring our little babies. I do start when I'm buttoning up the long suit with putting their feet in first because that warms them up, and then I button from the bottom until I get to where their diaper is, and then I button from the top down. And let me just tell you that you're still going to get it wrong. You're still going to come up with a button that you've got no place for and have to go back and do it again. This is absolutely normal. Please don't feel that you are doing it wrong, mamas. You will learn to become a quick change artist. You'll learn to do diaper changes. You'll learn to do dressing your baby, bathing your baby your way. Because actually, there are no rules about this. This is guidelines. This is things that we're telling you you can do to make it easier. But actually, it's simply time and getting to know your baby that is easier. And swaddling. Do we or don't we swaddle babies? Now, I think that's cultural as well. Depends on where you are from. I learn a lot of things from being in this multicultural society, and I learned the other day that France only started vaccinating newborn babies in 2018. However, I know that in Italy you don't swaddle babies. I like to swaddle a baby. Why? Babies have from 4 weeks onwards what is called a Moro reflex. It's their startle reflex, where with a loud sound or movement, their arms go out and then come back in. And when they're sleeping, often their arms will go out and bang them in the face and wake them up. So I like to swaddle, but I don't ever swaddle arms down. I swaddle arms across or arms up. And actually, I'm moving and I'm encouraging mamas to move away from the actual traditional swaddle where we use a big muslin and we wrap our baby. I'm encouraging you to move on to products that are very simple with zips up. Why wouldn't we use something that is much easier and in fact more comfortable for our baby? And we know that our baby is safe in that for the night, not able to bring it over their face. They're not going to get out of it and wake themselves up. So look at the swaddle ups, look at the sleep suits, look for, especially in our sort of climate here, for the lowest tog possible. If you can, find a bamboo material, because again, bamboo is hyperallergenic, cools a baby down, warms a baby up. Again, why would I not use something that is to help us? And I'm seeing someone recommending the Love to Dream swaddle. Yes, it is amazing. There are other brands out there that some mums might know about. I think one of them is called the Merlin suit. There's the Clever Mama Night Romper, which takes you all the way up until 9 months of age. So there's a lot of choice out there for you ladies now. Then, when to get their arms out. And we get their arms out from 4 months of age. I start with one arm out first during the day. And when I see they're comfortable with that arm out, I get 2 arms out. Now, when I say one, this sleep, this arm's out. Next sleep, this arm's out. And by 6 months, both arms are definitely out. And that's when I start then putting both arms out at night as well. But this is also going to be baby dependent. I know 9-month-old babies that love their swaddles for their night sleep, and they sleep beautifully. And if this is your baby, don't feel pressured. The important thing about swaddling is not to bring their feet together, because that puts their hips at a bit of an angle and that's not good for them. And also, I wouldn't sleep with my arms by my side. So please put them across, put them up. Your baby will sleep beautiful, warm, comfortable, and safe. And actually, maybe that's a good time to talk about the word safe. I love the word safe because I'm trying to create some new trends. I want to move away from saying SIDS, sudden infant death syndrome. So if I say safe, supine alone on a firm mattress in an empty crib, that means your baby is going to be safe for all sleeps. And when we say supine, we do mean on their back for sleeps that are unsupervised. So if you are going to go to bed yourself and sleep for a couple of hours, put your baby on their back. Why is this the safest position? Because your baby has a very strong gag reflex. If there was any potential for them to vomit, they would simply throw it out. And most times they'll turn their head to the side, vomit here, and turn back, which means there's no danger of them breathing that in. Then, alone, we do not encourage mattress sharing. I know there are moms who like to co-sleep. Co-sleeping is baby next to your bed, in their own bed, on their own mattress. That is still co-sleeping and absolutely safe. Why don't we encourage mattress sharing? Because when you're sleeping or your husband's sleeping, you may not be aware of what you're doing, and you increase the temperature in your bed because your body heat warms it up, and that can actually not be good for your baby. So alone, in their crib. And if you're using a crib next to your bed, please zip the sides up. The sides come down when you're bringing baby across for feeding, but go up when you're actually putting baby back for sleep. To again, make sure your little one is 100% safe. Then, firm mattress. What do we mean by a firm mattress? I do love something nice and cozy. And that doesn't mean your mattress has to be hard. It just means your baby mustn't sink into it. So definitely not on a pillow. And in fact, babies don't need pillows in their beds until they're old enough to pull it towards themselves. If you've got a baby with a bit of a flat head, and I don't think I've got flat head on here. Interesting. But if you've got a baby with a bit of a flat head, then there are pillows that we can recommend. But what we want to recommend before we say anything else is tummy time. During the day, putting them on their tummy helps that head round out nicely. And you can put them on their side to sleep when you're supervising them. And you can do side to side during the day, but on their back at night. And their heads will still round out. If you don't find their head rounding out, then we, like I said, can recommend a pillow. And we would recommend you see someone like an osteopath. There could be a little bit of tightness in their necks, and that can be resolved. And we do this kind of 4 to 6 weeks of age. So we said a firm mattress, not a hard mattress, just not something they sink into. And an empty crib. This means no blankets, no toys, no cot bumpers, nothing in the baby's bed with them, nothing on the sides of the crib. So if you're going to put a baby monitor, it's away from the crib. So the wires, etc., can't be pulled into the baby's crib as well. And that way you will find your baby is safe and sleeps well. So we're actually doing a webinar next week, Wednesday, same time, and we're going to cover all these subjects again, and I'm going to be able to show you some pictures. So please remember to sign up for that. The link is in our bio on our Instagram page, and when you sign up, it's going to be about 90 minutes of me again talking all about babies and mummies and helping you understand what you can expect. So my next topic, because I'm not getting any questions, is car seats. And please, I am going to say this with all respect for every single mother in the world. You may not take your baby in a car of any sort without them being in a car seat. It doesn't matter if you're holding them. You must place your baby rear facing, strapped into a car seat that protects their head so that it's a newborn, there's an insert. As they get older, the wings have a head height limit. So if your wings are up here, they're fine. But if they're down here, they're not fine. And it's not their legs. Let their legs go over the side of the car seat. That's fine. But when they're strapped in, they must be flush with one layer of clothing, and a finger only fits underneath that. And the car seat handle is always in the upright position because it is a further barrier. And if you can, please purchase an ISOFIX, because that is again another mechanical barrier. There is a question from Rafe.sn. Do we offer lactation consultation? We do. I am not a lactation consultant. I am a midwife with a lot of breastfeeding experience. And then my colleague Janice is a IBCLC lactation consultant. And between the two of us, we offer you home visits for small babies, online visits for those who are not in Dubai, and we will also help older babies with problems with feeding. If it's not a lactation problem, then actually we will refer you on to our amazing dietitian, Jordana, to help you with solids. And then Mrs. K. Pinto is asking, do we swaddle baby in the car seat? No, we don't. However, if you're watching our page, very shortly we're going to post what is called the car seat swaddle. And it's a very interesting little technique where your baby is safely strapped into the car seat and we tuck a little blanket around them beautifully. And that keeps them so nice and warm. But also when it gets a bit hot, it enables you to pull that layer off. Thank you for these questions. I'm loving them. And then Psalm 790 says, do we swaddle the baby during feeding, especially during night feeds? In fact, let me talk about that a little bit in depth. And what I would suggest is for the first breast or the first part of the bottle, you unswaddle your baby. Why? We want their hands out. It's a good thing for their hands to be out, especially at the breast, because their hands help the milk come through. And then when we actually change to the second breast, or we burping them, we're going to then change their diaper, swaddle them then, and then offer the second breast. Go back to the same breast, finish the bottle. And that way, when they fall asleep, which they do in the first 6 to 8 weeks, then they can stay asleep. Because otherwise, if you swaddle them after feeding, you disturb them. But you unswaddle them, especially at night, to make sure they wake up and drink properly. And that's why I like feed, diaper, feed. The diaper is not because they always need a diaper change. It's to wake them a little bit to make sure they take enough milk so you, mama, get a better sleep afterwards. And then Sephora is asking which month is better to cut baby hair. Actually, Sephora, this is something that I don't even advise on. Why? We don't cut our babies' hairs back in South Africa until they're much older. However, I do know that there is cultural shaving of the hair, and this is done at the appropriate time culturally. And of course, when your child is older, I will definitely suggest, if their hair is nice and long and getting in their eyes, that you do then cut at least the front of their hair. Baby's hair sometimes takes a long time to grow, and it does take a while for them to get hair to cut. So if you've got a little one with beautiful hair, I would say leave it alone until at least they can sit upright independently and you can explain to them what is happening. That's just my personal advice. I have no actual age that we cut a baby's hair at. So I think I finished talking about safe. I finished talking about car seats. And I just wanted to talk a little bit before I talk about essentials to buy about mums postnatally. You know, you're going through a lot of changes yourself. There are a lot of things that you don't even want me to talk about here tonight. But what I want to say is, please look for help. Please make sure you know your resources before baby comes. Like, who is going to see you for lactation if you have a problem? Where are you going to go? And if you need an extra set of hands, reach out early, plan that. Because I know at this moment there's a lot of mamas who can't have their mother come out. And a girl does need her mum around when she's having a baby. However, if they can't come, there's not lots we can do right now. But there are options that you can use to make sure you've got good hands on. Doesn't have to be 24/7, doesn't even have to be daily. Just know, plan ahead that you know, I can call somebody if I do need to have a break. And then remember, we start doing good habits for sleeping at 4 weeks of age. And good habits don't mean that you are actually going to get a good night's sleep. It just means we're starting to ensure you're getting that. So we need to take care of you, because if we don't take care of you, we can't take care of baby. And this is again where we're wanting mums to make sure they've got friends doing dishes, as in food for them, that you're on a food plan if necessary to make sure you're able to get your lunch in for feeding. And that when baby sleeps, yes, mama, you sleep. And I'm not saying you must close your eyes. Maybe when baby sleeps, all you do is you go and have a bath, or you read a book and you have some downtime. Dad's job is to arrange home help to make sure the floors are cleaned, etc. And please be kind to your husbands, ladies. They are very important as part of this time. And what do I mean by that? If they're doing baby care, they've taken baby away from you, they're doing what they think is helping you, don't tell them they did it wrong. Tell them they were amazing and let them do it again. So dads, just remember, you are equally important to us as the mamas. We really do value you, and this is your baby as well as mamas. So do step in. And I love what one of the dads says in a video I show in my prenatal classes: man up and love. That's all you actually have to do. And I love that statement. And just on the thought of prenatal classes, if we've got pregnant mamas out there, or you know of pregnant mamas anywhere in the world, they don't have to be in Dubai. Our prenatal classes are free of charge. They run on a Friday and a Saturday. So please send your friends, send the pregnant mamas our way. Let us help educate. And that's why I have to give a big shout out to someone like QV Baby, who are so pro-education that they ask us to do these things. And it's such an important thing. And I've spoken a little bit about doing skincare, about doing diaper changes. And honestly, mamas, the most important thing that you are choosing is not your crib or your pram or your car seat. It's how you care for your baby's skin. So choosing a product that is clean, that absolutely meets kind of the right standards, soap-free, parabens-free, formaldehyde-free, doesn't block your baby's pores. What more can you ask for? Do you know, I always try to actually make people understand, why do I love QV? I actually found QV on the shelf in Australia when I was working out there. And it was in a very, very small town, and I had to buy something to bath with that night. And I'm a bit fussy. So I read the contents, being a baby product, and I was like, yeah, I like this stuff. So I bought it for while I was there for my trip. And then I was quite sad because I came back to Dubai and I was like, oh, I wish I could get this product for mamas in Dubai. And the next thing, there it was on a shelf in the pharmacy. But unfortunately, it was in very limited supply. It was a hit and miss. Now you get it, now you don't. So while I was advising mothers to use it, they would come back to me saying, we don't have it. But now today, it's in the Middle East. It's in your pharmacy. So now I can again advise a product that I say with absolutely my heart behind it. So let's go on to talking about essentials to buy, because I do realize some of you are going to have to go and do bedtime shortly. And that means that you're going to want to jump off this call. And the first essentials is get somewhere for your baby to sleep. Get somewhere to change them. Get somewhere to basically feed them. Get yourself a nice comfortable chair. Get yourself a good cushion. And I have a few cushions I love. The BB Hug Me, the Clever Mama, the Breast Friend. And you've got to go and look at all of them and choose what suits you. I'm just telling you my loves. I'm not just telling you that you must buy these products. I'm saying these are the products that I recommend, again, from my heart. So making sure that you are choosing a product that works for you, the right chair for you, the right change table at the right height. I see moms bending over, backs breaking because they haven't thought about, how am I going to stand at this change table? And moms having to try and balance things on the side of the change tables. Get a change table with shelving, with little buckets that can hang over the side. So everything that you need for changing your babies at a hand's kind of reach. Because you can't leave your baby alone on the change table and go away. So making sure everything is there as quickly as possible. And then choose a crib that's going to last for a fairly long time. It's very nice to get all these tiny little fancy cribs, etc. But you want something practical. Something that has multiple levels, that is big enough that your baby can grow into it. And possibly even converts into a toddler bed. No bumpers in the crib, please. This is part of an empty crib. And make sure if you're putting your toddler in a crib that when they stand up, they're at shoulder height, not below. Because babies can, and especially boys, climb out of cribs. And that's not something that I'd like to encourage. Then, choosing some clothes for your baby. Don't go wild, mamas. Dads, I'm trying to preserve your credit cards here. Buy about 6 to 12 of each in 1 or 2 sizes, because we can't tell you exactly what your baby's going to weigh at birth. And when you buy your baby clothes, you're going to buy what you think, smallish size and a bigger size. So buying 6 singlets, 6 long sleeve jumpsuits or baby grows, depends on where you come as to what you call them. I don't buy too many hats because you're not going to use a lot of those, but I buy a lot of socks because they're going to go on the hands and on the feet. And generally when you're dressing your baby, you will use 1 or 2 layers. So have 6 of each in 2 different age groups, maximum 12 of each, and see what works for you and what works for your baby. Because again, every baby's different. And again, I like clothes that button up in the front. I don't like things that get pulled over heads as much as possible, and I never buy things that button at the back. They are literally impossible to dress your baby in. So if anybody's buying gifts for a mama for a baby shower or something like that, please think about these things when you're buying them. So we've spoken a lot about different topics. There's no more questions coming through, and I think it's because it is literally bedtime for you with your little ones. And I know as well that by now you need downtime. You don't need to listen to me talking away. But if you know a friend who's pregnant, you know a friend who's got a little baby, please get them to sign up for our webinar next week, Wednesday, same time, and they can sign up by going to our bio the link in our bio on our Instagram page and signing up free of charge. Let's teach mums about baby care. Let's teach you all about your little babies and about different products that are going to work for you. And if they don't work, maybe you'll teach me about a product that did. So I'm not seeing any more questions. I realize it's late. For some mamas, like I said, it's bedtime. So I'm going to wish you a good night and thank you for joining me here today. And I look forward to seeing a lot of you on the webinar next week, Wednesday. Bye, mamas.